Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about food sensitivity testing. I'm going to give you some basic information and what I think is the best test for food sensitivity and some ins and outs and when not to do food sensitivity testing. So let's get right into it. In this chart we have a response and time. So on day one, if you had a food that we consider that you are sensitive to, let's say gluten, okay? If you are sensitive to gluten and you ate the food on day one, okay, right in here, you may have a symptom related to that gluten response, okay? So I'm going to ask you a question. I want you to answer it before you move forward. And the question is, how long do you think your symptoms will last if you have food sensitivity to gluten? So what duration are you going to have in terms of symptomatology when you have gluten? Think of a number of hours, days, whatever you want, okay? Good. Now I'm going to tell you what the symptom response will be. Typically, your symptom response is about here. This period right in here is 3 to 5 days. Okay? So when you have, let's say, milk and you have a problem with it, you're going to have 3 to 5 days possibly of symptoms. Some people could be just 1 to 2 days. So symptomatically, you'll have 3 to 5 days of symptoms. Symptoms can be bloating, abdominal discomfort, diarrhea, brain fog, headache. So it could be any of those types of symptoms, okay? So in terms of symptoms, that's what it is. But if you look at the immunological response, what is the immune response related to gluten or dairy or whatever food that you are sensitive to? Think about how long the immune response is going to last. I'll give you a second. Think of a number. Is it days, whatever it is, okay? How long does the immune response last? Good. The immune response will last anywhere from this is 1, 2, 3 months. Your immune response can last up to 3 months or even longer depending on how you're doing the food testing. So most people will come in and they go, I've been so good, I've been eating so clean for a week, and over the weekend I had a pizza, okay? So they may have a symptom for 3 to 5 days, but the immunological response is lasting 2 to 3 months, okay, at least. So let's say you have it every 7 days. If you have the food that you are sensitive to every 7 days, your immunological response never goes down. Therefore, you're going to have issues forever. So it's either you are gluten-free or you're not. And you have to be gluten-free or dairy-free for a minimum 2 months. And you probably want to go even longer than that, okay? So let me explain a little bit more. When we do food sensitivity testing, okay, when not to do the food testing. 1, if you are on an immunosuppressant. 2, if you're on a corticosteroid, because it impacts your IgG, IgA levels. Or if you have low IgG and IgA. What that means is on blood tests, when you do it, and you can check for total immunoglobulins, IgG and IgA, and if it's on the very low end of normal or low, you should not do the food sensitivity test, because most food tests are either checking IgG or IgA. So if you have low levels of it, you should not do the food test because you're going to get false negatives if you're on steroids or immunosuppressants. Or if you haven't eaten the food for like 6 months, it might show false negatives, meaning you test for gluten, but you haven't had gluten in 6 months, and it might be negative, right? So you shouldn't do it when you have completely avoided the food. So oftentimes what I'll do is I'll take patients and tell them, eat the foods that you want and let's check for the IgG, IgA response, okay? Now, IgA, the half-life of IgA, the immune response, is about 6 days. Okay? So that goes up, it takes about 6 days to go to about half. Okay? In order to get the IgA levels down significantly, it takes about 7 half-life cycles. So 7 times 4 is 42 days. So a minimum of 42 days, preferably 60 days in my opinion, is what you want to be in terms of being totally gluten-free or dairy-free. The IgG response, the half-life is 22 days. So if you went through 7 half-life cycles, it'll be 154 days or 6 months. So IgA, IgG. Why do we test both? Because some people have more of a exuberant response for IgA and some people have more IgGs. So you want to test for both, not just one, because you'll miss it if you test for one. Okay? You want to do both IgG, IgA. What do I think is the best test or the best company to do food testing? Now, we're not sponsored by this company. It's a company that I use and I like, and I know they have very good results in terms of accuracy. Okay? The lab is called cyrexlabs.com, and they will check for cooked and raw foods. And the reason they do that is because they know when you cook, let's say broccoli, okay, the makeup of that broccoli will change when it's cooked or heated. Therefore, they'll check both cooked and raw foods, both the IgA and IgG response, right? And what they call it ELISA testing, which is the most accurate way to do it. Okay? Even with that being said, no food test is going to be 100% perfectly accurate. Sometimes going through an elimination diet is the best way to do it. So you eliminate the foods that you know you have or you possibly think you have sensitivities to. Eliminate it for 60 days, no cheating, and then reintroduce it to see if you develop any symptoms related to that food sensitivity. Now, it can be brain fog, cognitive difficulty, headaches, joint pain, muscle pain, abdominal pain, skin rash. It can be any of those symptoms, right? Wheezing, sinus congestion. So you have to be, cognizant of what kind of symptoms might arise and make note. You eat the food, see if there's any symptoms. Symptoms for 3 to 5 days, right? See if the first day you don't have any symptoms, it might show up on your second or third day. So when you do an elimination diet, you should add foods, one type of food, every 3 to 5 days, not every day, okay? So that's a clinical tip. Add food every 3 to 5 days in order to know if you have a symptom related to that food. All right? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you guys next week on the healthy side. Have an awesome day.